Hello and welcome to a workshop on a roadmap for future research into problematic pornography use. My name's Darryl Mead and I'm CEO of the Reward Foundation in the UK. This project began 2 years ago with the publication of the Manifesto for a European Research Network into Problematic Usage of the Internet by a group of 18 leading academics, some European and some from the rest of the world. They are leading scientists. Many of them have good history of research into the field of pornography. The main focus of their paper was the problematic use of the internet, particularly things like gambling, gaming and social media. I was interested in how far they took their interest in pornography and to see if it could help guide my future work and my colleagues' work. On that basis, working with Mary Sharpe, also at the Reward Foundation, we've just published an article in the International Journal of Environmental Research and Public Health. The paper was originally delivered at the International Conference on Behavioural Addiction in Japan in the middle of 2019, and it's now out under the very long but hopefully clear title of Aligning the Manifesto for a European Research Network into Problematic Usage of the Internet with the diverse needs of the professional and consumer communities affected by problematic usage of pornography. The paper is published open access and is freely available to anybody who wants to read it. Our research question was what topics should be included within future research proposals to meet the diverse needs of consumers, of recovery communities and of professionals. We highlighted 3 particular research areas that we think are key. First is reducing the risks from pornography consumption. If you cannot prevent pornography consumption, at least take the risk down. To help professionals and therapists obtain the tools they need and to support the recovery community. So first we'll look at reducing the risks from pornography consumption. How many people use pornography from the internet? Well, if we look for research in this field, there are not actually any really good up-to-date studies that look at the whole world. Our rough estimate is perhaps 1 billion people, or 13% of the world's population, are currently using pornography from the internet, but it's only an estimate. And at the same time, equally, we don't know what proportion of these people are experiencing negative outcomes. So research is required if you don't even know the whole shape of the problem. Another very interesting area of potential research is the liability for pornography suppliers. Pornography has never been proven to be a safe product, and there's a question of could legal transfer of responsibility be made to the pornography companies for the safety of their product. Could pornography companies be encouraged to take a proactive role in heading off the development of problematic pornography use rather than following their current laissez-faire view that a customer can never have too much pornography? It will be important to have research to boost the accountability of suppliers. Accountability can be achieved through government intervention or industry self-regulation. So far, industry self-regulation does not seem to be working in the consumer's favour. In general, the access to pornography is free, but the consumption risks are all transferred to the user. Little legal research has been done in this space. And by legal I mean research into the law. The powerful position of commercial pornography suppliers in the context of the attention economy leaves the average consumer poorly informed about how their sexual tastes and viewing behaviours are being influenced by free pornography. Commercial pornography suppliers use the data they gather to develop a deep understanding of consumer behaviour. Commercial suppliers also benefit from the access to artificial intelligence and other data mining tools to build market share and develop new markets. Another key area is what I'm hoping will develop into a major field, that of age verification for pornography. The world has just had its first age verification virtual conference. Happened in June 2020, and 29 countries were represented by 140 delegates. A full conference report will be available from the end of July on our website, and it reported that there's been progress towards law in the United Kingdom, Poland, France, South Africa and other countries. Australia and New Zealand have established high-level initiatives to consider how they might act in this area. Germany is utilising the enforcement mechanisms provided under their Audiovisual Media Services Directive to pursue pornography publishers based outside their own country. And there are groups campaigning for law reform in Sweden, Canada, the USA and many other places. The participants in the conference were able to review the latest evidence from the field of neuroscience, showing the effects of substantial exposure to pornography on the adolescent brain, entrenching patterns of behaviour which can seriously compromise a person's ability to form healthy relationships. They could examine the different technologies now available to carry out age verification in real time, and they were able to hear accounts from more than 20 countries on how public policy was developing in respect to the online verification of age for pornography websites. Another area of potential new work is environmental research, and by environment I mean the climate. How much impact does pornography have on the environment? Well, today there is one study linking watching pornography videos to climate change, but one study is not enough. And the environment offers an opportunity for a new front against the behaviour of commercial pornography suppliers. The pornography industry is now so large that it has been calculated to consume enough energy to produce 0.2% of global greenhouse emissions. The Shift project said viewing pornographic videos in the world in 2018 generated carbon emissions of the same magnitude as that of the residential sector in France. France is a country with 67 million people. And we have a little graph here suggesting that watching adult videos alone generated 82 million tonnes of carbon dioxide equivalent. Video on demand, things like Netflix, were slightly larger, YouTube videos were less, and the social networks were less. I'd like to move now on to the second area of helping professionals and therapists, and I'll spend a significant amount of time on particularly health policy. Health policy led by the World Health Organization, and in 2018 they released the 11th edition of the International Classification of Diseases. That included compulsive sexual behaviour disorder, without saying what sexual behaviours are included. My recommendation for researchers is that they get to a point where they can insert the word pornography into future wordings of disorders in the International Classification of Diseases. It was left out because by having a wide definition of sexual behaviour, they were able to jump through all of the hoops to get the directive, the compulsive sexual behaviour disorder into the ICD-11. The massive scale of use of pornography now means that perhaps as much as 80% of all people who are being diagnosed with compulsive sexual behaviour disorder have a problem using pornography. While I'm in health policy, I will have something to say now about the experimental work that we need to do to help support our better understanding of the impact of pornography. The key things we need are longitudinal studies to give us a better strategic foundation for understanding problematic pornography use, and these would be much more powerful and stronger if they included large-scale brain imaging studies to gather evidence before and after people have quit or have been given treatment. It's essential to develop a wider evidence base covering all ages and stages of the human life cycle for people engaging in problematic pornography use. There should be much more focus on women, as they are now the main sector of growth for problematic pornography use. Equally, our data should embrace sexual diversity and investigate usage among the LGBTQ+ communities, where levels of mental health disorders and chemical dependencies are higher than in the mainstream population. Could problematic use be a contributing factor? The 2020s is the decade where the training of health and social care professionals should begin to incorporate a deep and broad understanding of all problematic uses of the internet as a matter of course. This will be a communication and public relations exercise, and it should be recognised that within the field of problematic pornography use, we are starting from a low base with modest levels of training or resources for people working as professionals and therapists. My own organisation, the Reward Foundation, has developed a full-day course for training medical professionals in just the basics of understanding problematic pornography use. The new research should be leaning towards giving professionals a wider toolkit to support treatment of all the different forms of problematic pornography use. Ideally, the next 10 years will see us moving towards a landscape where we have double-blind placebo trials for drugs and proper longitudinal studies covering time periods that allow us to take a broader view of problematic pornography use. Is it a disorder that is slow to develop and potentially also slow to heal? The next decade should see the debate about pornography use and erectile health fully resolved. Dialogues about the impact of pornography use in the context of violence against women and children also require more experimental approaches if the discussion is going to be able to move from correlation to causation. Pornography-induced erectile dysfunction has been identified as a key factor that causes male sufferers of problematic pornography use to seek treatment. This area still lacks clear before and after brain studies. Porn-induced erectile dysfunction has also been linked to escalation to child abuse material. As desensitization, tolerance and hyperfrontality develop, a problematic pornography user needs more shocking material to feel any arousal. Therapists need to know how long it can take for a problematic pornography use problem to develop and what external or internal factors can act as triggers. Reports from the recovery communities talk about the triggering influence of everything from life events and rites of passage to social networks and the manipulation of viewers' tastes by the algorithms used by the commercial pornography suppliers. The withdrawal process from problematic pornography use, both physical and mental, seems generally similar to that of other problematic uses of the internet. The only unique characteristic is identified so far is flatlining. The literature does not adequately characterise the features of flatlining as a symptom across the population of users withdrawing from pornography use. Can early pornography use harm health? This is an important question. Back in the 1990s, adverse childhood experiences became popular as a way of trying to understand what happens in society and what the impact of bad things happening to you as a child can be. And that led to major publications and these sorts of ideas of how you have the scales of things through life from your birth to your death, and adverse childhood experiences keep having an impact later on. So what are adverse childhood experiences? They're things that could be created by domestic violence, parental abandonment, having parents with mental health conditions, being abused in all of the different possible ways, being neglected, having a member of the household in prison, or growing up in a household where there are adults experiencing problems with alcohol or drugs. Now, if you have experienced ACEs and the traditional form as understood, the more of them you have, and the example of research I'm quoting here, where people did in Wales and the UK, people with 4 or more ACEs compared to people with no ACEs are much more likely to go to prison, to develop heart disease, to frequently visit the doctor, to develop type 2 diabetes, to have committed violence in the last year, and to have health-harming behaviours such as high-risk drinking, smoking or drug use. All this brings me to think about what could we learn about where pornography fits into adverse childhood experiences. Well, because ACEs were developed back in the 1980s and 1990s, and then this is before internet pornography existed, there's no inclusion of anything like that as a potential ACE. But quite a lot of people in recovery communities talk about a negative impact of porn during childhood, and there's quite a lot of research in the area. So if pornography use by children can be linked by research to adverse health outcomes, the claims of pornography as a public health crisis suddenly become much more credible. This is important research that we should be thinking about. I'd like to conclude by looking at supporting the recovery community. And by recovery community, I'm thinking of groups like NoFap, which currently has 2/3 members, Reboot Nation, tens of thousands. SAA, Sex Addicts Anonymous, have chapters all over the world, and certainly I know quite a few people in the UK here who've used that service. We also have things like Gary Wilson and his Your Brain on Porn site, which gets several million visitors a year, and has produced books and other sorts of things as tools. But when it comes to academia and to studying the community, there aren't really many worthwhile studies. The few studies to date that have often focused on obscure areas of sociological analysis rather than looking at the success or otherwise of communities in helping problematic pornography users meet their recovery needs. Recovery communities are a cheap solution to a potentially very expensive medical problem if you have an addiction. But at the same time, the people in the communities don't really want to be studied. Members just want to be healed or to help others to heal. There is some acceptance that good research could help. There's also a recognition that for some members with problematic pornography use, recovery communities are only part of the solution. They may need help from therapists and other professionals. Quantitative research looking at the elimination of pornography is the highest priority. Does it really reverse sexual dysfunctions and have a positive impact on the variety of mental health disorders? The field currently has extensive anecdotal evidence to support these suggestions, but it's not a substitute for large-scale, well-grounded studies. More systematic assessments of the success of educational strategies would show how effective they can be as risk reduction strategies. What role will learning play about the addictive potential of problematic porn in reducing demand? Does learning about porn-induced erectile dysfunction reduce consumption? Thousands of anonymous self-reports on the recovery websites show that the availability of knowledge of the effects of internet pornography on the brain was sufficient to encourage users to experiment with quitting porn. And when they did, a range of mental and physical health problems remitted or cleared up. Only when heavy users quit porn did they realise that the conditions were related to their porn use. Formal research into this phenomenon would be valuable. A separate investigation into the issues of prevention versus cure would also be interesting. We are suggesting research to compare the benefits of never beginning pornography use versus the treatment of the problem when it has been cured. At a population level, are people who quit ultimately as mentally and physically healthy as those who have never engaged in problematic use in the first place? What methodologies might help unpack these questions? I'll conclude with 3 recommendations. We need a more visionary research agenda, and perhaps there are elements in my talk today that will help power that development of a research agenda. The research agenda needs to be linked to the agenda to end sexual exploitation, and we need to find ways of attracting funding, the scientists, and the effort to boost both national and international research programs. Thank you for listening.